Hello and welcome back to my channel. I am the CrossFit Nurse. Thank you for joining me for what is going to be the quarantine series. I'm joking, I'm not going to call it that. I'm going to call it my COVID diaries. So welcome to the CrossFit Nurse COVID diaries, episode 1. So I basically wanted to start these COVID diaries to help me as a healthcare professional and someone that is following obviously self-isolation and what's going on within our society at the moment, and to try and have a positive Q&A discussion also within this whole video. So this is not going to be very long, but I'm going to try and release one each week to keep you up to date with what's happening with me at the hospital and with me in self-isolation and what's going on in my training life as well, because obviously that's been deeply affected by everything in the closure of the gyms and CrossFit boxes and everything else which everyone is feeling at the moment. So without further ado, let's go to topic number 1, the hospital. So as you know, I'm probably not going to go into it in great detail, but if you want to know exactly what I do, go back a couple of videos and have a look. But as a brief introduction, I am a cardiac respiratory trained nurse at a specialist hospital within London. And I can say that since hearing about the corona virus outbreak from other countries, our body at the hospital has started to prepare plans to be put in place for when it came to the UK. So we weren't especially in the dark. We are a specialist hospital dealing with heart, cardiac issues and lungs, respiratory. We have 2 separate buildings for heart and for lung, which is just across the road from each other really, and we treat a very wide, complex range of patients who have complex cardiac and respiratory issues. We deal with specialist respiratory issues such as cystic fibrosis, and we also deal with complex congenital cardiac patients. So that just gives you a sort of a brief overview of the type of patient group that we have, and especially within the COVID outbreak, they have our patient group itself is a high risk group because they already have a very complex underlying health issues. Within this week, we have seen a real fast forward in people's understanding and people's reaction to the virus itself. I think, personally speaking, not this week, last week, I wasn't that worried about the virus. In fact, I was like, oh, you know, Europe is overreacting completely. I work with a lot of European nurses as well, and who were freaking out a lot, and I just thought maybe they were overreacting, and I am the first to hold my hands up and say, okay, I was wrong. So at the start of this week, our hospital sort of were putting out quite a few newsletters to the staff members about awareness of patients that might have been having symptoms such as the cough, fever, spiking temperatures of above 37.8, having high respiratory rates, high heart rates, things which aren't really classic flu, more an aggressive flu. So we do have a protocol for flu. We have now got obviously a protocol for COVID. So what our hospital started doing is highlighting the patients that we needed to start to swab. Following swabs, patients are then isolated as much as they can. So if we have a side room, we would move that patient to the side room and try and nurse them from that area to reduce contact with other patients. When we got the swab back positive or negative, then they will be moved to what we call a red zone, which if they're positive, so that means that they go to the red zone, and then certain wards are kept as the green zone as well. And that's how our hospital has done it. And this is at the start of the week. Things have got very real this week. We've started discharging patients who are inpatients or who are non-urgent patients from our hospital. So anyone who is cardiac respiratory is now getting actually discharged, and we're taking patients from sister hospitals within central London who are struggling with the patient load of COVID, because we are changing our hospital into a facility to treat COVID patients. How this makes me feel? I was one of the first nurses at because we obviously all work in shifts and in teams, to nurse a patient who was positive for coronavirus. And if I'm honest, it was very frightening times, you know, an unknown virus, and thinking you need to be there for your patient and you need to reassure them because there's such massive media going on about it, and they're obviously worrying, the families are worried, they can't have visitors because obviously the infection and the spreadability of this virus is great. It infects 2.5 people, which is why isolation is so important. And yeah, it did go through my mind. I was worried. I think the first night that I was looking after this patient, that I was putting on all of my PPE, so personal protective equipment. For the virus, we need to wear gloves, apron, FFP3 mask we call it, which is a special mask which reduces the droplets getting in to our respiratory system. And I was thinking, at one point I had to go to a different part of the hospital to get extra masks, and thinking, gosh, are we equipped for this? Obviously there's shortages across the NHS for PPE equipment, and this week there was evident shortages within the hospital of hand sanitizer and gloves, which the sizes weren't there. But I think a lot of things are now being done to make sure that healthcare workers are covered with the correct PPE equipment that they need, because it's vital to be able to treat these patients with the correct PPE that we need. So that's basically what's going on at the hospital this week. I've worked a good excess of hours, which won't be paid back to me probably, I would doubt. In fact, I think bank owe me money. Just so crazy that now more than ever the NHS is relied upon to help in these desperate times, and we are being recognised by the government, which is amazing. But this is what we do day in, day out. So that is the hospital summary. Hospitals. Personally, my hospital is emptying, getting ready for a big surge in patients. PPE equipment hopefully will be restocked, fingers crossed. Swabbing for staff isn't happening unless you're in direct contact with the positive and then you've started having symptoms. And then of course you are then to be in isolation for the 7 days and 14 days, and taking the necessary precautions of occupational health before you come back to work. And swabbing for patients. If a patient who has tested positive has been in contact with other patients, they are also swabbing those patients as well, I believe, in our hospital anyway, especially if they have become symptomatic or spiked a temperature as well. And proud of my colleagues, in summary. Very proud of every colleague that I'm working with so far. Nurses, doctors, healthcare assistants, everyone, cooks, everyone. And proud to be in the NHS currently. That's how I feel so far. Topic number 2. Oh yeah, I'm tired. I feel very tired. Always. I do feel very tired. There's been an excess of hours, and I think that NHS workers are really feeling it now, and always hungry because everyone's eating our food before we get a chance to shop, which thank you M&S, Tesco, Sainsbury's, Co-op, everyone for putting aside some hours for NHS staff to come and shop from you, so thank you very much. So topic number 2, life in isolation. Social distancing has really not hit me that much yet, because I've been at work so much. So for this week 1 coronavirus diary, I don't think I've got that much to say. However, yesterday was the first day that I had off, which was Saturday. So Saturday was the only day that I had off in the daytime, and I woke up and literally remember thinking, what do I do? Because I'm so used to having a routine to wake up, go to WIT, go and train, or go to work, then go to WIT and train, and then see my partner or spend time with friends and things like that. And I think waking up on a Saturday and having no agenda and nothing to do was a bit of a shock for me, a shock to the system, I would definitely call it. I also, within obviously the space of 24 hours, which everyone had, WIT closed earlier in the week, but every other boxing gym and things like that, if they hadn't closed prior to that, closed on the Friday. And I think that was a very real part of a lot of people's experience so far, that okay, this is it, this is real. And I don't know about anyone else, but that really sort of heightened my own anxiety, because for me, definitely working out and having a space not in my home that I go to work out really helps me mentally, physically. It's a release, especially between home and the hospital. So that was a big thing for me to have to mentally process. I did have a little bit of a where do I get my motivation from? A lot of CrossFitters will definitely agree with me in saying that motivation comes from each other. We all work out, maybe separately, but we're all together as a team, as a family. So that's really difficult for some of us to just go, okay, now I'm gonna take it on my own, outside, or in my garage, or in my living room, or in my bedroom. But it's a new challenge. I did have a freak out and I did get very anxious by it, so I'm not gonna cover it up and be like, I was positive all the time. I wasn't. I cried. I cried for a good hour. And that's okay, because I think I was also very tired, very emotional by everything that's happened so far, and haven't really stopped to be able to be like, okay, you've done well so far, Liv. You're doing okay, you're doing great, and you're looking after others, and the way you look after yourself, i.e. having that downtime to go and train and everything, has been taken away from you because it's necessary. I had a cry. I trained. It wasn't the best training session and it was a struggle motivationally. I wasn't very motivated, but I did it. And then I chatted with my partner Ross and cried again in a good way, and tried to explain how I felt, and then we went for a walk on the beach, which was really, really nice. And then I decided, you know, we're all still here, we're all in it together, and that's what counts, everyone. And that's where I'm going to leave topic number 2. So summary, mentally, it was a very difficult week of realisation. I got very emotional and had a bit of a freak out, combined with being tired and highly emotional. I think it just hit me a bit hard, which is okay, everyone, and it's okay to cry and to talk about it, and that's the main thing. Other thing that has really helped is chatting with friends, so over FaceTime and things like that. So I've chatted to a number of my friends and they've really reached out to me, and to you guys as well as on my Instagram have really helped me mentally this week. So thank you all so much for dropping your lovely messages and words of support and everything, and seeing that you guys are all coping in complete social isolation. Great, also helps me. So keep doing your thing and I'll keep doing my thing. Going to nurse all you guys. Topic number 3, before we get to our Q&A, topic number 3 is training. So as I said to you, I've not really had to self-isolate training so much, so this is going to be very short this week. I have done a little workout, and I do plan on hopefully showing you some of my workouts and filming them as well to put into this section of my little CrossFit COVID diaries, CrossFit Nurse COVID diaries. Oh, it's catching on. And that's basically it for training. I mean, I went on a run today. Oh, who'd have known? 5.4k for Livy Tom. It was a struggle. I'm gonna put that out there. I don't enjoy home workouts and I don't enjoy running. Give me a heavy barbell, which I hopefully am going to be picking up on Tuesday. Well, getting it dropped, or I'm gonna pick it up and drop it to my house. So hopefully some barbell stuff will be coming back into the home workout section. But we have to do everything with what we've got, so I know everyone's in the same position. And thank you to all my lovely PT friends who are providing great home workouts, and obviously JST Compete, who I am programmed by, who are providing their athletes with good substitutional home workouts, which I'm enjoying. Section 4 of the vlog. Look at my calluses, they're still there. The Q&A. I have written your questions down. So question number 1, which I really liked, so I thought I'm going to start with this one. Are you proud of yourself for what you are doing? And thank you to myself and to all the healthcare workers. And this person wrote, yes, I am. Like I said earlier, I'm so proud of my colleagues. I'm proud because we do it every day, and that's why I'm proud. People are seeing what we're doing, what we always do, and that's what makes me proud, because we are acting no different to how we act day to day, and we're doing no different really to what we do day to day. It is more stressful because we don't know about this virus. However, we're treating it like we would a flu, and everything else in professional manner, upholding our profession, which is for the people, and that's what we're doing it for. We're doing it for all of you, because we care and we're here to care for you, and I'm very proud to be a part of that. And it is scary times, and we are working exceptionally hard, we are under a lot of stress, but we also have a lot of support, so thank you very much. Question number 2. Tips for fellow nurses on how to cope, de-stress and stay positive. I do like this one. Tips for coping. I suppose I've not shown mentally very well this week that I'm coping that great, but I definitely think a coping mechanism is to let out your emotions and to talk about it. So please do talk about how you feel with your partners and your families. It's actually a weird situation that you feel isolated yourself because you are working alongside people that actually have the virus, that you feel quite isolated in yourself. I think that's what I felt a lot. Whether, you know, I don't think that people actually want to be around me. But keep chatting, keep talking to your family members, de-stress, read, meditate, make sure that you take a second to think about how you yourself are feeling. I think that's really important. And stay positive. I think that the general public are doing a really great job of making every healthcare professional feel very positive right now, and thank you guys for that, definitely. And question number 3, so I'm only going to choose 3 questions, else we could go on forever. Question number 3 is what to say to help a loved one who is a nurse, doctor or healthcare assistant or anyone working within the NHS right now. That's a tough one, and I had to think about what I would want to be asked. So what to say to help a loved one. Are you okay? Yeah, are you okay? And that can be a difficult question actually. So it can be a yes or a no, or it could be like, I'm not sure. And if it's a not sure, it's a do you want to talk about it? Because sometimes we don't want to chat about it, just drop my questions. We don't want to chat about what we've done at work. It can be quite difficult. Number 1, patient confidentiality. Number 2, so much happens in a day. It's so overwhelming to talk about that sometimes you don't want to talk about it. So I think to say to a loved one is difficult. Words can be difficult, but actions are really great. And I was saying to my partner yesterday, it can be the little things like coming home and having dinner done, or not having any dirty washing, because we've worked all day for others and we've worked picking up things and caring and talking to relatives or doing all these different things, and to have to come home to extra jobs and things can be really difficult. So maybe if you work or live with a healthcare professional, if you live with a healthcare professional, maybe do a nice gesture for them. Especially if you're self-isolating, maybe practice some baking and bake us a healthy banana loaf. And that's that. There were things I just I wrote my top 3 on there. So thank you so much for watching. Thank you everyone that has taken the time to message me this week and really ask me if I'm okay, because it does mean the world, and all the support going towards all of my NHS colleagues and workers. We all appreciate it so much, so thank you very much. And thank you to all of you for staying at home and for doing what you're doing to help us relieve the load, the patient load who are coming through our doors every day. So I hope you've enjoyed. Please click the like button, smash the like button, click subscribe. That's the wrong, please like and subscribe my video. Keep tuning in, because hopefully we'll be in this together and the content will get better, I promise. And happy Mother's Day to all the mums out there. My sister, happy Mother's Day, Naomi. And please keep safe, stay at home until the government tell you otherwise. Please look after yourself and see you next week. Yay! Thank you for watching.